Hi, I'm Cayla Friend from Dr. Mann's Tuesday Nassau Clinical. Today I'm going to be performing a dressing change for a central venous access device, and typically those devices are placed on the patient's chest, but for video purposes it's going to be placed on my patient's arm. So the first thing I would do is enter the patient's room, perform hand hygiene, introduce myself, verify the provided orders, gather my necessary equipment and supplies. I would identify the patient using two identifiers, name, date of birth, and the wristband, provide privacy, and then provide a mask for both the patient and myself. I'm going to ask my patient to turn their head away from the dressing site, get them in a comfortable position. I'm going to apply clean, normal gloves while I remove the dressing. And I'm going to just remove the transparent dressing, check for any redness, irritation, signs of infection. Check that it's secure, the insertion site, surrounding skin. And then once that, I would clean it with alcohol, remove the dressing, check it all, take off my gloves, perform hand hygiene again, and then I would be starting my sterile procedure. And this is my sterile kit for today. It's open because I've been practicing it just for clinical purposes. So I'm going to open up my kit, put on my gloves, and the patient and I both still have our masks on. The patient is still facing away from her site. This is now my sterile field. I'm going to clean the site with alcohol first, and circular motions around the site, underneath the line, everywhere that I'm going to put the transparent dressing. And then I'm going to put the wings back. For video purposes, I'm not actually going to. And then I would sterilize the area again in back and forth motions, again covering the entire area and getting the line clean as well. So once that is removed and clean, I'll provide a skin protectant, which I don't have in my kit, and then I would put a disc underneath the line to secure it and keep it in place. And then I would put the sterile dressing on top of it, put my initials and the date of which the dressing was changed, remove my gloves, perform hand hygiene, dispose of all of my soiled items in my kit, help the patient into a comfortable position, put the call light in reach, document my findings and teachings, and ensure safety with the side rails, putting the bed in the lowest position. And then that would be it. Thank you.